I think just hearing everyone's ideas, the fact that we could do a little bit of a rundown of what Neighbourhood Health was, and how it can look for people in terms of joined up working, and then basically give everyone a question around what can you innovate with around the 150,000. So the fact that we had lots of different ideas from lots of different people, and all of the ideas were workable in practice, but they really understood the neighbourhood health model, and how we engage with our patients. And even included things like the digital inclusion elements, and how we interact with our patients. And I guess for neighbourhood health, it's about making services work for the patient that's at the centre of that. So it was a really, really good session. The buzz in the room was amazing, absolutely energetic. So I really enjoyed it. And all for a good cause. The winning charity got £5,000, which is brilliant. I think the holistic element of looking at a person, people aren't just health problems or health cases. Everything interacts health. I'm a community nurse by background, public health nurse, and very much social aspects and influence health, physical aspects influence health. So it's really important that we understand the person as an individual, but also those elements that interact with people. So, how does their housing affect them? How does their financial elements affect them? And all of that has a knock-on effect for health. And I guess with the neighbourhood health model, all of those come into play, because we can support with those that isn't just health related, but with the overarching, I guess, aim that we do better their health outcomes. But actually, if they're exposed to more community organisations, it also widens social networks, and kind of all those sorts of things. So it's really important that we look holistically at someone rather than just oh, you've got a heart problem, that's all we're going to focus on. I think it's been a really good day. I think it's been really lovely to not be in a venue that's very traditional for kind of digital conferences. I think the venue's kind of helped people come together a bit more relaxed, and it's been a bit more fluid. The fact that there's been lots of different people in the room from lots of different backgrounds, not necessarily just traditionally health and NHS. It's been really good to hear how different areas work, but everyone's working for the same reason. Everyone wants to improve kind of health and improve people's outcomes, increase kind of people's accessibility to digital. But there's a real energy, a real buzz in the room. I think to come out of the event, particularly from my work that I do around digital inclusion, I want people to think that all they need to do is ask a question of patients, that let's not overcomplicate trying to figure out if someone's digitally excluded by age, or make a stereotype because of where they live. Just ask a question, because the patients and the service users are the best people about their own health. But also that thing of, I hope people have picked up some conversations on the networking, how things are working well in other areas, but also how things are maybe not working as well, and how they can kind of learn from that and develop that into their area. So whether it's NHS or whether it's a private organisation or a supplier or anyone like that, I think there's definitely lots of learning that's come from the networking.